Good afternoon. Thank you for joining us. I'm Allison Hilkaya. I'm with the Washington State Department of Health, and I want to welcome you back to today's webinar. It's part of a series on themes related to long-term disaster recovery and resilience, specifically for the healthcare workforce. And today's topic is burnout reduction. Sound relevant? If you've missed any of the previous sessions in this series, they were excellent, and you're going to want to view the recordings, and the links are available to you at doh.wa.gov/POP. We're going to drop that link in the chat for you. The chat will otherwise be disabled during today's webinar, but you can place questions in the Q&A box. So as we begin, I'd like to call your attention to the features of the platform we're using today because not everyone's familiar with GoToWebinar. So on your screen now, what you're seeing on the left is the viewer. That's where you're going to see the presentation. And then on the right, you're seeing the GoToWebinar control panel. And that's where the Q&A box is. That's where you can also select your audio mode. And I want to give you a hot tip on this one. That control panel likes to disappear, but you can change that setting by going to the file in the upper left-hand corner of the control panel and selecting, what is the selection called exactly again? Uncheck the box that says auto hide control panel, and then the control panel will stay open for you. And on the next slide, you'll see that if you have any challenges during the webinar and need technical assistance, my colleague Felipe Flores can help you out. His email address is there on the screen. He's the one presenting the slides for you now. Thank you, Felipe. And we are going to try to have time for questions at the end, so please do drop them in the Q&A box as we go along through the presentation, but I won't interrupt Dr. Maseth while she's presenting. I'll save all those questions and we'll share them at the end. I also want to let everyone know that today's presentation will be recorded because we want to make the recording available to folks who registered but who, for whatever reason, weren't actually able to attend. And I want to make sure we are actually recording. As I say that, yep, okay, recording has started. So before I introduce our wonderful presenter, I want to say just a little bit about the Power of Providers initiative that we are hosting today's webinar because we want to partner with you, healthcare providers, in the mission to vaccinate Washingtonians and protect them from COVID-19. The Power of Providers was launched almost 2 years ago now, hard to believe, by Governor Inslee and Secretary of Health, Dr. Shah, with the goal of increasing access to and correct information about COVID-19 vaccines. Towards that end, we ask providers to help by making a commitment to use the SAVE intervention. The S is for seeking your patient's COVID-19 vaccine status, asking them if they're ready to receive the vaccine, educating them if they're unsure, addressing misinformation they may have heard, and then either vaccinating, or if you're not licensed to administer vaccine, referring them to a location where they can get the vaccine. Finally, the E stands for empower patients to become vaccine ambassadors in their own communities. So the Power of Providers initiative has grown over time, but the goal remains to help you, healthcare providers, to serve as trusted sources of health information in your communities. And we want to empower you by equipping you with the latest clinical guidance, which changes from time to time regarding COVID vaccines. We want to give you patient handouts, conversation guides, anything that you need in order to have those discussions with your patients about COVID-19. And we want to build a relationship that endures beyond this pandemic so that we're ready for whatever next challenge comes our way. So hopefully you're asking yourself, if you're not already a member of the Power of Providers, how can I join? We have individual providers from across the state and every county who have signed on to the initiative, over 4,500 of you. We also have many healthcare organizations and facilities who have signed on behalf of all the providers in their locations. And POP is also endorsed by most prominent healthcare associations in the state. And if that doesn't yet include you, you can join if you are a healthcare professional working in any capacity in a healthcare setting. You don't have to be licensed to administer the vaccine because, as I've been sharing, that ability to educate patients and provide information is just as important. There's a link that is going to go into the chat. Actually, it's already there. Learn more about POP and join at doh.wa.gov/join POP. And that link will also be in the slide deck, which we'll be sharing with you after today's presentation. It'll have a link there where you can go to the member sign up form directly. We hope you'll join us. So, peer-to-peer webinars are part of the suite of resources that we offer to our members. We invite healthcare providers who are experts in their field to share information with their peers and colleagues in this platform. And DOH is not providing the content. The speakers and presenters, again, are experts in their field. All we're doing is providing a platform in which they can share and you all can access their content. We have a few more behavioral health support. Actually, there's for sure one more in this series coming up in May that you can register for if you haven't already. And then we also have on May 12th, a long COVID treatment Q&A to try to help providers understand symptoms their patients may be presenting with and effective treatment methods. So access the links for those in the chat or in the follow-up email that will come out after today's webinar. All right, that's enough from me. So with no further ado, let me tell you a little bit about Dr. Mosseth, who's here today to share her wisdom. Dr. Mosseth is a practicing clinical psychologist and a senior instructor at Seattle University and a co-lead for our agency's behavioral health strike team. She also owns Astrum Health, where she consults with organizations and educational groups about local disaster preparedness and building resilience. Dr. Mosseth has trained community groups and professionals regionally and globally. Her work and research really focus on disaster, behavioral health, resilience, recovery from trauma, as well as preparing for critical incidents and response when they occur. She's worked abroad extensively with disaster survivors and refugees. She's also trained first responders and healthcare workers here in the US, and she currently serves as the adult mental health clinical representative on the Washington State Disaster Medical Advisory Committee. And this is not an exhaustive list of her credentials and accomplishments. Thank you, Dr. Mosseth, for being here again today. We really look forward to learning from you.
Thank you. Hi, everybody. Good afternoon. I'm just going to go ahead and pull up my slides really quick, and then we'll get going. I'm happy to be with you today and talking about burnout again. Let's see. Are you able to see that? Not yet.
But it is still white.
Let's see. Play. It was having trouble. The screen isn't. Sorry, I'm trying to fiddle around with the settings here. It says it's showing. It says that it's showing Microsoft PowerPoint, but there's nothing there. So I'm not sure. One moment, please. There we go.
There it is.
Hey, there was a little bit of a delay. There was just a little tech delay. Is it on there now, or is it white again?
It's on and it's showing your whole monitor, but probably if you make it full screen.
Wow.
There, now the window is full screen for us.
Just there's that insight. There's that little snippet of insight that you get into the chaos of my desktop on a semi-monthly basis. What's going on? Is it a reflection of burnout? I don't know. I'll let you be the judge after the end of today's talk. We'll see how it goes. But thanks for bearing with us. There's always a little bit of a tech challenge. But if the slides are visible there for you now, I am good to go. We're rolling. Happy to take questions at the end. I think we'll have a little bit of time for that. I know we talk about burnout a lot, and we have talked about it in the past. So I'm just going to kind of jump right in and try to approach it from with some different ideas, right? Some new ideas about how we can address this concept that we're all very familiar with, whether it's through lived experience or sort of vicarious trauma and experience and stress from the patients that we're serving as well. So that is the plan. I'm going to talk about sort of some of these fueling sources. We know that the length and complexity of how the pandemic has unfolded really is probably the primary factor, but it's certainly not the only really intense and quite complex factor that's playing a role in burnout right now. And then I'm gonna cover a lot of content that I really want to encourage you to look at as something that you could either apply for yourself individually or to support colleagues. I have had feedback from some people in recent months, especially as we head sort of into the longer days, the weather starts to improve, the mood tends to uplift a little bit. I have had feedback from folks that say, you know, I'm feeling pretty good right now. I'm seeing a lot of people still really struggling and suffering, but how can I support others? So hopefully today will give you a few tools in that direction. But it's really kind of mix and match. These last, the second two, the second and third bullet points are really mix and match. Like take away pieces that are applicable for you personally, but also things that you might do to support colleagues and even patients to an extent as well. This is like sort of the fundamental concept chart that we like to start with because it really puts some perspective over the long-term process. So when we experience a large-scale disaster, we tend to, as a framework, right? Not specifically, it's not an exact thing, but we tend to experience a framework of stages. And what I think is the important takeaway is that this chart and the representation of a large-scale disaster is meant to be about 18 to 24 months. That's sort of like the range of the chart. If you see the dotted line, that's up to 1 year. Clearly the pandemic, I mean, that's so far in our rearview mirror at this point. So the scale and the size of these phases and how this actually played out in real life is certainly not as simple as this particular chart and framework. This was the update that I worked with DOH graphic design on, sort of trying to represent the additional waves, the additional variants, and how that played a role. And the reason why I included this again today is that when we talk about burnout, understanding the successive disaster cascade waves and the way that the degree of already depleted resources, emotional and physical behavioral health resources, really plays a stark role in the degree of burnout that folks are experiencing, is a key place to start. We did not experience just one impact. We experienced at least 3. Depending on where you are in the state, where you're joining from today, you might have had a regional issue. Maybe there was a fire or a flood or a different regional situation that really negatively and significantly impacted your community. That would potentially be a 4th impact or a 5th impact. Every time we have an impact of that scale, it is a struggle to sort of regain the resources, to regain the coping skills, and to find that emotional equilibrium that we're seeking. And so the pattern of the succession of events that kind of piled on top of us is significant. The non-technical term for all of that, right? The trauma lasagna that you may have heard about before. Of course, that's not a clinical phrase, but the idea being that, you know, it's multi-layered, right? What we've been through. I'm sure many of you have seen photos like this or seen this in the mirror from time to time over the last couple of years. It's really a strong image, in my opinion. And, you know, none of the experiences of burnout that many are going through right now are isolated. They're not in a bubble. It's not just the virus itself that caused any of these things. It's political, it's social, it's cultural, it's economic. There are familial factors. There are lots of really important influences on human behavior that have played out in the role of healthcare in a way that we have never before seen and may never see again in terms of this particular type of disaster. A pandemic on this scale, obviously not seen before. And it is, it's arguable that, you know, our models clearly aren't designed to sort of reflect the nature of this complexity. But the reason why I created a slide just really to reiterate this point is that we can't treat this burnout that we're seeing right now like burnout of the past. It's not caused by the same types of things. It's not the kind of single event or single impact or even double impact types of burnout that we may have seen historically. This is a really different kind of a thing. And we need to recognize it as such so that we treat it and sort of apply the appropriate interventions from that lens of accuracy. I wanted to start with some numbers before we get into what to do. So this is from the American Medical Association. This was a study that was conducted, gosh, they collected the data in 2021. And they looked at trends over time. I'm sorry, there's a weird typo on that chart, but it's 2011. There's historical data that they were referencing in 2021. So 2011, 2014, 2017, 2020, and 2021. The line represents the percentage of respondents experiencing at least one manifestation of burnout. So sort of a manifestation of what burnout might look like for them in their lives. And I don't know, because they haven't, the study didn't include data from 2022. I suspect that it's around a similar number to what it was in 2021, if not a little bit higher, because the staffing has not improved a great deal over the last couple of years. The interesting thing about this study was the dip in 2020, and my interpretation, and this is just my opinion as an interpretation of these data, is that the emergency itself and at least initial, throughout the first 6 months of the pandemic, the initial response to healthcare was generally socially positive, and the nature of being in an emergency where your hair's on fire and you're going and going and going is actually a protective factor against burnout. And when we tend to see burnout in the form of this fundamental exhaustion is after enough time has passed for the emergency to sort of like the adrenaline response slows down and you just don't have any more in the tank. And then we start to see the exhaustion, and then we start to see the burnout, which absolutely is characteristic of 2021, and I would argue also 2022. And those numbers are pretty significant, right? We're looking at 63% of physicians with at least one manifestation of burnout in 2021. That is, I'm not a math expert. I can read statistics like it's my job, because it kind of is, but that's a lot, right? That's way more than half. So we need to not ignore this and continue to support it and support each other and address this for sure. This was a Mayo Clinic paper that was put out. The title is there if you're curious to read the data and look into the numbers more. But what they were trying to capture was satisfaction with their work-life, another typo, sorry about that, I'll fix it, work-life integration, and then also symptoms of depression. And the narrative is sort of on the side there where it says work-life integration satisfaction dropped from 46%, which is less than half, down to 30% in 2021. And then average depression scores rose from 49.5, which, anytime depression scores are in the 50% range, that's concerning to me as a clinician myself, right? But then we're over that, up to 52.5% in 2021. The sample size was fairly significant here as well. So I think these results are in fact meaningful in terms of effect size. Another finding from this same study, professional fulfillment. Do you find fulfillment, a sense of professional fulfillment in your work, represented by the white line, dropped from 40% to 22.5% between 2020 and 2021. And then, would you choose to become a doctor again? Would you choose to become a physician? Dropping to 57.5% from 72%. So this is just this is some data that sort of represents and I believe supports the necessity of these conversations and the development of additional and more robust support systems within our places of work, not just external. It should not be, again, my opinion, it should not be on individual providers to reach outside their network and the system in which they're working and find support for themselves. We need to address these things internally in order to sort of build up and protect each other and the healthcare system in general. Because what happens if these trends continue? That's not good for any of us, right, across the board. So again, this next section is around leveraging support for others, and then it's going to turn into a more personal sort of approach. But I really do encourage you to take and choose whatever you think might be helpful for you personally. I'm going to talk about some classic organizational workplace psychology theories in terms of how they may apply in addressing these issues of burnout. So everything on this is just a big list for you. These are factors related to how people process stress. So arguably, long-term exposure or even medium-term exposure to moderate to severe amounts of stress is one of the huge contributing factors to burnout, as the research shows us, a lack of boundaries around restorative time. So when we continue to work and we continue to give energy out of ourselves into the system that we're part of, and we don't have the opportunities, or we don't create the opportunities, which is part of what I'm going to argue for today, creating the opportunities to have really clear and distinct boundaries that help us sort of enhance our restorative time, not our escapism, right? But our opportunity to recharge and recover some of that energy that we're busy giving out all the time that we're on shift. That's really going to be able to predict at the end of the day the degree of burnout that somebody is experiencing. So those two things are essential. The factors on the white side of the slide are all sort of known social or physiological factors or of some kind. And the things in the blue box are all psychological measures, measurement factors that we know can contribute to stress response, how people process stress. Now, what I'm not going to do in today's webinar is, get into each one of these things in detail, but I'm going to pick out a couple and really highlight, I think, some opportunities that we have to investigate, like how our personal ways of processing information, how we explain things, how we think about what we are capable of doing. It translates in some ways into how we're perceiving our experience of burnout and how much we may in fact be having. So I list these here in case it's something you're interested in looking into more. We do have the potential to talk more about them next time that we meet for the third one of these sessions. But I just wanted to put those out there as correlates and contributing factors for your interest if you were curious. So I'm going to start in terms of organizational psychology by talking about this theory. This is an old school one. There's different iterations of this that have been backed up over time. This is McClelland's Acquired Needs, and it's about motivation in the workplace. These are the things that we know people need. And I put this here because I want you to consider how are the ways in which these needs are being met or not being met for you personally. And what does that look like at work? So we know that the need for achievement is a big one. That's the need to perform well, to be successful at things, to not necessarily receive kudos from other people. That definitely works for some people, but it's like, what is your personal sense of mastery over things, and what are some things that you might still struggle with or really feel like you're not bringing your A game and not maybe doing that well. The next one is the need for power. And when we go through a large-scale disaster, our sense of power and our sense of control gets eroded significantly. And so everyone has different levels of this. And if you're curious, you could just Google like an acquired needs assessment to sort of give yourself a ballpark for which one of these might be higher. You might just look at them and be like, oh yeah, I know that I'm more of a need for belonging kind of a person and I don't need as much power. Every single person has different individual sort of scales for these. And there's certainly no right or wrong set of how much you may need in any given time. But I want you to consider which of these needs have not been met and which ones are being met and which could continue to sort of be met in a potentially different way. So how do we bolster them up? Because they are all important, but at different levels to different people. So the need for power is the one that gets eroded most significantly when we have a disaster, because nobody's really in control of much. We're doing a lot of reacting rather than proacting. So if that's something that you've experienced where you feel like the system has prevented you from feeling powerful or feeling in charge of something, it could be that that need is being manifested in other aspects of your life, right? In other hobbies or other activities. But if you're not getting that need met or any of these needs met, what are some healthy ways, right? What are some healthy ways to exercise that need for mastery, that need for power or control, and that need for affiliation and belonging? The need for affiliation and belonging is one that is going to be related to the second half of today's talk. And it's really essential because it's connection, right? Everybody needs a different level and a different type, a different set of relationships. There's no two formulas that are exactly the same, but humans generally need connection and belonging and association with each other. And if that's something that for you personally on a professional level starts to feel like it's being eroded, it absolutely can contribute to burnout because you're not able to identify with and connect with colleagues. And with a lot of turnover that's happened, this might be one of those consequences for sure. This is another theory of motivation, and I'm going to explain why I picked this one in just a second, but there are 3 components to it. The first one is self-efficacy, which is, I'm sure, a term that you've all heard of before. It's your belief in your ability to achieve a particular goal. So the example that I'm giving is an academic one, but if I study hard, I can get an A on the test, right? Instrumentality is gosh, that's the second typo. Sorry about that. Belief in your ability, or sorry, belief that your achievement on a particular goal gets you what you want, whatever the outcome is, right? If I get the A, then my final grade will be higher. That there's not some sort of mechanism in the system that's going to prevent me from getting that end goal if I make this little achievement step. And then the third piece of the model says that your motivation is based on the desirability of the outcome, right? How much do you care about that A in the class? The person who developed this theory argued that all 3 of these components have to be present for someone to feel motivated. And motivation is really akin to purpose. So when we talk about ingredients of resilience, it's important to consider the ways in which your sense of purpose and your sense of motivation are being met or not. Do you have a sense of meaningful motivation in the direction that you want to go? So if any of these are missing, then it sort of takes the energy out and prevents the motivation from being there for people. The one that I want to focus on in terms of recommendations for development is self-efficacy. This is the most incredible variable. It's so powerful. Low self-efficacy is correlated with all kinds of less than ideal outcomes for people across sectors, across age groups. When we talk about economic issues and social issues and academic things, it doesn't matter. When we look at all different types of outcomes, low self-efficacy is generally not a positive thing. High self-efficacy, on the other hand, is a very positive thing. So it's just a list of correlates that research has shown. But I really want to move on from, yes, we know it's a good thing, and talk about how to get it stronger, right? How do we increase the sense of self-efficacy that we personally have to have some control and have some power and have some motivation, right? And how can we assist others with doing the same kind of thing? If we take it at face value that self-efficacy is important, how do we get more of it, right? And there are these 4 ways. The first way is performance attainment. This is, I did it. The second way is, if they can do it, so can I. That's through vicarious learning and watching somebody else do it. That's similar to you, ideally. Verbal persuasion, such as what a provider might do, or a counselor, or a teacher, or mentor, right, is, you can do it, I believe in you, right? And it does have to be realistic and genuine. And then the 4th way is to sort of teach yourself that you are physically able and ready, that when you get worked up about something, that you reframe it in your head as like, I'm excited for this. I'm not nervous. I'm not anxious. I'm excited. And it's that cognitive reframing where you can control your physiological response to stress. So that's how we get the information. If we want to increase it, we want to think about all of those sources of self-efficacy as a pie again. And it's really interesting how it breaks down. The first bullet point here is 75% of the pie, making and achieving small goals. If you want to increase your self-efficacy, your sense of motivation, your sense of power, you need to make and achieve small goals. If you are setting goals that you are consistently not reaching, it's going to negatively impact your sense of belief in your ability. You want to encourage clients to do the same thing, patients to do the same thing, and colleagues. If you are in a leadership role, it is helping set people up for success by not setting the bar at an unrealistic level. We need to be reinforcing as much as we can those small steps towards success right now. The next bullet point is vicarious exposure, like if they can do it, so can I. That's only about 10% of the pie. And each one is significantly smaller. So that first one about making and achieving small goals is the biggest, most influential one. When we think about motivation and our sense of purpose, we really want to be oriented around our core values. If you find yourself really frustrated and confused as part of a meeting, if you're sitting in a meeting, or if you're sitting in a conversation with someone else and you're just sort of overwhelmed with all of the things that you shouldn't say or can't do, and you're not sure, you know, what end is up, I would really urge you to consider focusing on how you engage with that meeting, how you engage with the other people around the table or on the Zoom. Orient yourself towards your core values and the how you do it, the why. What are the things that are fundamentally important to you? Because if you really boil it down to that and you use that as a framework to engage with other people, it number one, it's just a very grounding sort of activity to do. But it gives you a framework, it gives you a foundation, so you're not feeling like, I just don't know what to do here. It's like, no, I know that I want to be a compassionate person, so I'm going to act with compassion. And how does that look? Like, what is the manifestation of that? Compassionate people listen to others. So maybe that would just be sitting back and listening and not interrupting, as an example. So focusing on process as a way forward too. I'm going to spend the next 20 minutes or so talking away from theory and away from some of these high-level concepts and into what this might look like for you personally as you reflect on your own sense of motivation or purpose, as you reflect on your personal self-efficacy, and what are the ways forward that can contribute to focusing on these development aspects rather than all of the stressors that are contributing to the burnout? What are things that we know are going to help lift you away from that experience? So the ingredients of resilience might not be any surprise to you by now if you've attended any of these webinars in the past. There are 4 of them, and we're going to talk about purpose and connection today. So we're really keying in on that aspect of motivation, which is so important to burnout reduction. Sense of purpose is the cumulative effect of meaningful goals. We define purpose as long-term aim or guiding principle based on meaning. It's the impact we want to have on the world. To be very frank with you all, as we work through our healthcare system and the challenges, many challenges that are significant right in front of us, our sense of purpose needs to be reiterated and defined, and we need to come to terms with what that is. I would strongly argue that for many of us in healthcare, the sense of purpose that we feel right now is likely to be starkly different than it was in 2018 or 2017 or whenever, depending on how long ago you started practicing. So reevaluating, reorienting around what is your current sense of purpose is, I don't know, I guess that's one of the 2 big takeaways from today. Meaningful motivation is simple and complex. It's both. It is the underscore for why you do what you do, and it's also details on a daily basis. What are the things that you're doing that contribute to the bigger picture for yourself? So it's about really keying into that and doing some thinking. These are the rhetorical questions, maybe not rhetorical. I just would encourage you to think about these items as we move forward today. Do you feel alignment between what you do, why you do it, and the impact you want to have on the world? If not, why not? What are some of the roadblocks and what might be done, right? If yes, then how can we reinforce those things? How can we draw not just your attention to those things, but how might you engage others to identify them for themselves? When it comes to goals, what you do, or meaning, why you do it, which one is the most challenging, right? And when you think about your role in healthcare and your role as a provider, is it the meaning or is it the what, the goal setting on a daily basis? And identifying where to start is a good spot. And then the third question, what would you identify as the biggest obstacle to your sense of purpose right now? That could be like a family issue, a practical matter. Maybe it's financial or economic. Maybe there's something, a personal health issue that's come up. There are certainly no wrong answers to any of these questions, but I would argue clinically, and with my professional hat on, that walking yourself through these questions and answers is a step in the right direction. So here's some more research for you, and I included the links. So if you're interested in additional edification on the research itself, you can follow those and read more. But sense of purpose is correlated with all kinds of positive outcomes. This is not a surprise. That's why it's part of resilience, right? That's why it's one of the fundamental ingredients for resilience. So general well-being, physical and behavioral health, interestingly, greater income and net worth, which I think is interesting. And then recovery from negative events, right? arguably all important at different levels for different people. So how do you do it, right? Start with self-efficacy and core values. Start with what is your belief in your ability to achieve? How do you increase your sense of self-efficacy, and what are your core values? Then based on those things, identify goals that you want, right? Process or content goals. Do you want to listen more effectively in a meeting? Do you want to engage with patients in a more meaningful way when you're talking to them? What are the goals based on what are the things that are important to you? And then through that, you have your sense of purpose. And some of these might be just sort of mental exercises. Some of you may benefit from writing some of them down and kind of putting some sticky notes up that kind of remind you about your values or in the direction that you're oriented, so that when you have a particularly challenging staff meeting or an email that you get about a budget or somebody not coming to shift, that you reorient yourself around what it is you can do, that sense of empowerment and sense of efficacy, and how you can apply that to go about your day, right? Breaking it down practically. I just like this quote. I think it's interesting, and it really resonates for me in terms of purpose. The best day of your life is the one on which you decide your life is your own. That's the empowerment piece, right? No apologies or excuses. No one to lean on, rely on, or blame. The gift is yours. It is an amazing journey, and you alone are responsible for the quality of it. This is the day your life really begins. Now, you may not agree with every component of this quote, but the piece that I really appreciate is the personal reflective piece. The power of saying, if I believe today is going to be a better day, I'm going to be right. Or if I believe it's going to be a really hard day, I'm going to be right. Something that I have said to clients and patients many times over the years is, whether you think you can or you think you can't, you're going to be right either way. And so that cognitive piece, arguably, in my opinion, is really, really important when we need to reorient around our personal motivation and sense of direction right now. The last ingredient, not the last one, but the last one for today that we're going to focus on, because it really can be directly related to burnout reduction, is connection. And this is our people, right? These are our sources of support. Connection is arguably one of the most important pieces of well-being. So as a function of well-being, it would directly impact burnout. So you may be familiar with the Harvard study of adult development, connections being pretty much the #1 most important factor. So they identified it as social fitness. And they defined social fitness as positive relationships that keep you healthier, happier, and live longer. It's not a super big sample, but it was longitudinal, right? So it's hard to keep a large sample over a long period of time. 724 folks, 2 years for quite some time. And relationships are #1. And it's not a matter of number, right? It's not a matter of how many relationships we have. It's the degree of quality. And so I'm not saying everybody needs to run out and get a bunch of friends. I'm saying that it's a matter of cultivating and curating healthy relationships of all different types that are meaningful for you personally. And fairly briefly, I'm going to break down some of the findings that they had in this study of the 7 keystones of social support. So these concepts have been iterated in the research as well. The first one is safety and security. So who might be your people for that? People or person, individual, right? Learning and growth. Who are the folks that encourage you to try new things? Emotional closeness and confiding. Who know everything or most things about you? Who can you be vulnerable to? Really is the one that's getting at. And then I just love this picture of these colleagues kind of goofing off because that's the last one on the list here. Fun and relaxation. Who makes you laugh, right? I have a colleague that I know I've mentioned before on this series, but one of the things that we do in terms of supporting each other, we both do pretty hard work. And we work with a lot of people in pretty significant degrees of distress. And our funny thing that we do is send each other tweets and memes that we find really, really hilarious. They're somewhat inappropriate. They're really good things, right? About like parenting struggles and relationship issues and just pieces of humor that we really agree on. We're really on the same page with our humor. And we will often wake up in the morning and just text each other like a meme or a tweet just to kind of get the day going. And that's part of the relationship that we have with each other. The other 3 on this list also, identity affirmation, who gets it, right? Who you really are and what you're going through. Romantic intimacy is on the list. And then informational and practical help. So who can you turn to if you need something? And that's a lot to keep track of. So here's the chart, right? You could screenshot this if this is something that you wanted to follow up on. Who are your sources of support, right? And if there are any boxes that are completely unchecked, it would be worth just sort of a thought exercise about if that's okay, if that's not okay, and why or why not, and what might be done, right? What might be done differently if you feel like there's a box or two that is missing or could use some additional support. And you know, it's not to say that everybody has to have all of these, right? This is just sort of a summary of takeaways of relational best practices when it comes to the type of connections that we pursue. Okay, a note about healthy boundaries here. I've said something about boundaries probably in every talk I've ever given, because the research also says pretty unequivocally that workplace boundaries and the lack thereof is probably the biggest contributor to burnout. So when we're serious, when we get serious about reducing burnout, we have to start with boundaries. I had the privilege of last week meeting with a group of supervisors from around our state. And these are high-level administrators in one of our state systems. And the comment was made to me, or the question was asked of me, /comment/question. We're told that we are on duty 24/7, 365. That's the message. How do we push back against that message? And that's not a question that I can answer, but besides to say that you just need to push back. We I believe have an obligation to each other and to ourselves to say no to that and to support each other in saying no, and to start by carving out time where we're not available and we are engaging in restorative practice, not escapism, not substance use, right? Not just vegging, but doing things that fulfill us and sort of recover that energy that we spend so much of our time giving out to other people. So if you are in a role where you feel like you are on 24/7, 365, I would ask you to consider to what end, for whom, and to what end. And that if we can collectively agree to push back on this idea that we need to constantly be available, it will allow us to be available longer for more people in a helping role. So I feel very strongly about this one. The research supports the concept that healthy boundaries at work are a huge predictor in burnout reduction. And the third bullet that I added on this slide was this idea of letting others into your house. If you have a guest coming over to your house and they rampage around and break things and insult your furniture, right? You wouldn't invite them back. And our mental and emotional boundaries and our relational boundaries should be similar. If you have connections with people who are not healthy for you, think about what some additional or sort of bolstered or stronger boundaries might be. What are some other things that might work? And consider that house metaphor as you're working on that process. 3 ideas for developing stronger connections. I just want to sort of summarize these for you. The first thing is to work on communication. If you feel like you have a lot of people in your circle, but you don't know them very well, or you have a lot of colleagues that you encounter on a regular basis, but you really wouldn't necessarily feel comfortable opening up to them, one of the ways to start that and to engage in that process is through active listening and through asking questions of other people to learn more about them. It's pretty likely, in my estimation at least, that if you're willing to ask questions and learn more about other people, you can find ways of connecting with them and things in common that you had probably no idea that that was the case. This happened to me yesterday at a conference that I was speaking at in Portland, and I was sitting down and talking to this woman happened to be a superintendent of schools in a district in Portland, and we just started having this conversation and asking each other questions, and it turns out we had all of these random things in common, like, you know, that we played volleyball in high school, and like the conversation got all over the place, and it was just it was weird, but it was really neat. It was something that never would have otherwise happened if we hadn't taken the time and had the opportunity, right, to be willing to connect and to do active listening with each other, right? That's what we were really trying to do, is just get to know each other better and find out more about one another. So I think that our workplace relationships, especially in healthcare, are an opportunity for this. And at the same time, I fully recognize, and I do this too when I'm in my clinic, it is patient, 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 go, go, go. It's like, hi, oh, hi, I wish I could talk. I gotta go, somebody's waiting, and you're just like ships in the night. I get that, but part of the procedure that is like sort of the other version of that, or the other side to that, the counterpoint to it, if you will, is by making time to have those conversations, to carve it out, like put it in your schedule to go have coffee with somebody, or have lunch, or walk out to the car and talk, and give yourself those windows. We would love for it maybe to be a little bit more organic and more spontaneous about just being able to connect and associate, but that's not always an option. And so sometimes we have to be intentional, we have to put it in the schedule, and we have to carve out time to make it happen. But when we look at the research in terms of how valuable connections are, communication is the first step, right? It's one of the big starting points for how we can improve this, if that's something that you feel may benefit you. The second one is about insight and awareness, and that's recognizing it's sort of a combination of connection and adaptability. It's how do you adapt your communication style, and how do you adapt your vibe and your energy when you're interacting with other people, right? We all have people that we work with that are very gregarious and outgoing, and there's just a lot there, and that's fine. That's who they are as people. But maybe that type of person would benefit from a different approach, right? Rather than being really quiet, maybe being a little bit more upbeat when you encounter them, or the other way around. I'm not saying that that's the formula, but people's personalities and people's expressions sometimes warrant a different sort of energy being brought to the space. And so insight around what you are bringing. The one that I've been talking about a lot lately is the walk-up song. It's baseball season now, and thinking about, what is your walk-up song? Like, what is the soundtrack when you show up? What's the energy that you want to bring to just an individual meeting with somebody or a group, right? And then from that insight, you can engage in behavior change. The final piece that I want to advocate for today is expressing gratitude and appreciation. The Harvard Adult Development Study and other successive studies on relationships and connections have validated so significantly this point, where the simplest, most effective relationship builder that any of us can do is to say thank you. That is by far the most simple and also most effective positive reinforcer that we have in our arsenal. And it's so easy. It's so accessible, right? We can say thank you in a multitude of ways. It doesn't have to be the words. It could be actions. It could be just peace and time and sitting with someone, just sharing space. But I would argue very strongly that expressing gratitude and appreciation is really low-hanging fruit when it comes to how to increase connections with other people. So those are the concepts for today. I think that's it in terms of content. It went, I think, as quickly as I expected it to. So we have a little bit of time for questions, maybe 10 minutes or so. I don't know if there are any. I can't see that. For some reason, it's never been visible to me, but yeah. If there are questions,
Thank you.
Let me know.
Yes. Thank you so much for that presentation. That was super relevant content and so well presented. Attendees, if you haven't had a chance to ask a question, it might be because the question box is hidden for you. So just look at that control panel again, and there's a tab across the top that says View. And if you click on View, you'll have boxes like the chat and the questions. You can check the box to enable the view for questions. That's just a tip if it's hiding for you. We do have one question, Dr. Masseth, that I'm not sure if you are positioned to answer or not, but it's about sort of the historical context here. So going back to early in what you shared, have there been other times when burnout for healthcare staff specifically was as significant as this, or is COVID the first time that people's mental health has really been impacted in this way?
That's a great question. The closest thing that we have to compare to in this regard is the flu pandemic 100 years ago. And the research, number one, we didn't look at burnout in the same way. I mean, I wasn't back there collecting data, but we didn't measure burnout in the same way, and the data aren't there. So there are records of people leaving the profession. There are records. There are personal anecdotes and sort of historical case studies about burnout from journals that, you know, from physicians and nurses and things writing about their experiences. So we have that sort of anecdotal piece of it. But in modern history, when we've been measuring burnout the way we sort of conceptualize it now, nothing has compared to this. And I think it kind of makes sense why. There are, of course, you know, there are large scale disasters, and there are certainly wars and refugee situations that have been ongoing for years and years. But there has never been a singular incident in history that has affected all of the global population at the same time. So in each of those other instances, what has happened in terms of these psychological measures is that you have an infiltration, that's not the right word, an influx of people or resources or providers from other places that are fresh and can help, and there's this sort of ebb and flow. There are none this time, and that was not the case this time. And so when it's a localized disaster, you tend to have ebbs and flows in resource availability and staff availability, and it was just, there was no island, right? There's no island of resources in the pandemic that we were able to draw from for this, which is part of what makes it so unique. So I'm hoping I'm answering that question.
Yes.
That's
yeah, you did.
what I have to offer.
Thank you. That's insightful. And we have another question, and it's around like a program. How would you approach the process of trying to implement or create a burnout prevention program or a wellness program for healthcare providers? And this attendee is asking specifically about a public healthcare setting, but I think it could apply more generally than that.
Okay, great question. Number one is that leadership has to be serious about it and not just talk about it. It has to be, money has to be moved and priorities have to be shifted to prioritize provider wellness in a way that changes the structure of how people engage with the content. And what I mean by that is offering things that are like what I was saying at the beginning, like external, like making providers, not making, but facilitating burnout reduction in a way that's external by saying, you have all these resources, go find it. That's different than saying, we're going to tackle this from the inside out by strategizing from leadership down, sort of a systemic approach to changing the structure of shifts and the availability of, you know, colleague support, active listening, but we're going to do it internally. We're going to change and shift those priorities here so that all of that stuff is available in-house. And it's not just something we're talking about here and then expecting you to go do externally. So the development of a burnout program, I mean, I have a lot of ideas about how that would actually look. But the number one thing would be to structure the timing of shifts and the sort of the flow expectation when you're at work and on a shift, as well as the structure of collegial support, being able to talk to each other and having time to do that. It is absolutely, as far as I can tell, not something that is prioritized in most healthcare systems, and not just in Washington. Patient care, you know, rightfully is prioritized in a lot of cases. I get that, but if a provider burns out and can no longer care for a patient, then that's one less patient down the road. And so preventing the burnout and being very, very proactive in the present allows the provider to effectively engage in patient care for many more years or months down the road. So it's an investment, but a program like that would be an investment in being willing to be more transparent about how serious the need is, and then be willing to actually structurally change some of the priorities, which is tough. Not gonna lie.
Thank you for addressing some of the steps that would have to happen to change a system to make it more resilient for the healthcare workers themselves. We have another question. I think it's about perhaps the intersection between mental health and physical health. And so the question is, how can providers stay positive is the word that the questioner is using here. How can providers stay positive if they're also dealing with their own chronic health challenges? I think physical health is what's meant there.
Okay. I would actually suggest that you don't have to stay positive all the time. I would suggest that part of being real and being genuine with yourself in your own recovery and your own struggle is some transparency around that. I think that, well, I think that being transparent for all of us about the things that are challenging to us is a way to increase connection and help validate. Because I'm not guessing, I know you're not the only person that's struggling with things like that and those similar kinds of challenges. And so I guess what I would recommend is don't put pressure on yourself to stay positive all the time. Like, be willing to say, I can't today. And that's a boundary, right? I can't today, I can't engage in this way. I'm going to do X, Y, and Z instead of A, B, C, because X, Y, and Z is all I can do today. And that's all right. The second step in that process is to, after you don't expect yourself to do A, B, and C if you can't, is then to work on the emotional component of not feeling guilty for that and getting the support around you're doing X, Y, Z, and that's fine. It's perfectly valid. And other people are doing X, Y, Z too. And when you have the energy and time to feel positive or more hopeful about things and engage in a different way, then you do ABC when you have the time. But if your capacity is around a different set of challenges right now, that's all it is, and that's okay. And so that internal monologue about expectation and sense of pressure is a really, it's a key place to start, and to get some support from other people to help you validate that that's all right to do. You do not have to be positive and happy all the time. That's not human. And to take some pressure off of yourself for it. So you have my permission, at least. Allison and I will get on the same page
I
with
approve. Thank you.
Yeah.
We're going to take one more question. This will be the last one, our final 3 minutes here. And it's a question about, I think, trying to create that space for providers to do the necessary self-care. The question is, what about a decrease in mandatory continuing education requirements as a means of creating more time for providers to do self-care, just given the severity of burnout that may be really pervasive at this time?
Absolutely. That's an option. I mean, or let's think about it differently. Why can't we have stuff like sort of motivation and psychological science around explanatory style? Some of those things that I was listing on the slide with all of these psychological factors, those could be CMEs. Those are important to your patients. Those are important to you as a person too. And it's science too. It's data. It's not just somebody's idea about something, but it's things that are backed up with research. And so, either shifting the concept around what is included as part of CMEs, which I know behavioral health is being included more and more, so that's good. And also maybe shifting some of the requirements. Yeah. But we need to think creatively here because we've never been through this before. So absolutely.
Thank you so much for your time today and for this incredible presentation. Thank you, listeners, for being with us today. I hope you gained useful and practical insights that you can implement and take better care of yourself and your colleagues, and perhaps even impact system change in your workplaces. I want to shout out Felipe Flores again, who's worked behind the scenes on all the technical aspects of this webinar to make it possible. And I want to wish everybody a really good weekend. I hope that at some moment, in some way, you can either step out into the sunshine and take a deep breath, or connect with someone that you love and find a spark of joy.
Absolutely. Thank you so much, everybody. Thank you. Thanks, Allison.
Dr. Massa.